Hi, my name is Dr. Mostovoy, and today I want to talk about dental health and breast cancer prevention. It's been an interesting subject, to say the least. For many years, there's a big controversy about root canals and breast cancer. So today I'd like to share with you what I know about this and what I've learned in the last couple of years addressing this particular issue. So bear with me. We'll go straight to the presentation. And as you can see here, this is a mouth. I know it looks like a circle, but it is a mouth. And all around here, we can see upper and lower teeth. And what's interesting is that in Chinese medicine, each and every meridian actually goes through your mouth and through your teeth. A lot of people get confused about meridians. Let's forget talking about meridians. Let's talk about an electrical grid. So this electrical grid, for instance, tooth 7 and 6 in the upper right corner will be connected to one's stomach. Whereas if we're looking at tooth 6 and 7 in the lower left corner, it's connected to your intestine. It's a stomach-intestine meridian, and it also happens to be going through your breast. Now, one thing I have to tell you that if there is a disturbance of a signal on a meridian level or on that grid level, obviously it's going to disturb signals all along that grid line. And that's the connection that Chinese have figured out probably 5,000 years ago. Now, your health basically going to be very, very much connected to your oral health. That's something very, very important that we can't ignore. And let me explain why. Because everyone knows that 1 in 8 women will be getting breast cancer in her lifetime. However, very few people know that women who have had gum disease are 11 times more likely to get breast cancer. And more than that, 75% of all American adults will suffer from various forms of gum disease. Let me explain what is gum disease. For instance, diseased tooth and gum periodontal pocket that's formed, of course, will create inflammation, may affect the health of your tooth, and will affect your immune system as well. A couple of books that I would suggest anyone who's interested in the subject that have been published. Of course, there's much more than this, but you can start reading things like Root Canal Cover-Up, and another book called Rescued by My Dentist, written by a good friend of mine, Dr. Douglas Cook. He taught me over the years that I've known him that there's also harmful effects of high-speed drilling. What is high-speed drilling? Most dentists today will use a high-speed drill, and unfortunately that creates a lot of heat and that will damage your tooth. Dentists know that heat, of course, damages the teeth, and they will spray cold water in that particular area. However, that's not going to help much. It may not be an immediate thing, but definitely that jeopardizes a lot of tooth health. Also, what Dr. Cook has mentioned is that there is no metal in human body that is safe. All metals are, of course, conducting electric currents, and they are going to affect that grid. There's been a 5-year study that was published with 300 breast cancer cases, and the study was published by Dr. Robert Jones. 93% of women with breast cancer had root canals. 7% had other oral pathology. So it's very important that we realize that in the majority of cases, there is some connection to oral dental health, specifically when it comes to root canals. Now, my advice to you is never get root canals, because they may lead to degenerative diseases such as heart disease, joint disease, arthritis, and cancer. And of course, they all contain all sorts of pathogenic bacteria like strep and staph bacteria. And of course, they will enter your bloodstream. Antibiotics are not going to be very helpful because this area is severed with nerve supply and blood supply. And finally, one thing that I need you to consider is that toxins in your root canals actually leaking in your system actually are neurotoxic. And being neurotoxic, they may be affecting the tumor suppressor gene, a very important gene that the immune system has to suppress tumors. And of course, if that tumor suppressor gene is turned off, it's kind of open season on you. Everything's connected to everything else. This is quoted by the great Leonardo da Vinci. So the secret, of course, the secret is no longer a secret because everyone knows that inflammation will affect heart disease, will affect cancer, will affect diabetes, and many other degenerative diseases. Inflammation discovered by thermographic imaging. Let me introduce what thermographic imaging is. Over here you can see on the right side of this patient's mouth, because it's their anatomical right, there's this big red spot. It's a hot spot. Just like on this patient's, it's on their left, big red spot. These are signs of inflammation. Whether the inflammation comes from a tooth or from a gum, we cannot say with thermographic imaging, but we can pinpoint the area, which is very important to pinpoint the area of inflammation to actually go in and probe in to see what's going on with a dental exam. Speaking about dental evaluation, we're looking at general evaluation is based on patient complaints, symptoms, dental examination, and of course, when necessary, there's going to be an X-ray. We have conducted a study that was published in European Journal of Ophthalmology a couple of years ago. And the way we designed this study is that for all of our subjects were going to have infrared thermography, and then they're going to have up to 2 examinations within a 12-month period. We actually had 90% confirmation rate. So thermographic imaging will tell us one story, and within that 1 year or 12 months, we find that there is a correlationship. So there is a very, very strong correlationship between infrared thermography and dental exam. And what surprised me the most is that 70% of patients had absolutely no symptoms. In other words, thermography, just like with breast thermography, dental cranial thermography, as we call it, will also gives us heads up as to what may happen because we're looking at early signs of inflammation. If you're interested in reading more about this study, you can just go to this URL at the bottom of your page and take a look at this at your leisure. Let me give you a couple of case studies. This person came to us initially in June of 2010. She had TMJ, temporomandibular joint. She had a few regions of hypothermia, and we sent her for a dental exam. Dental exam revealed absolutely no abnormalities. However, a bite split one was done, and because she was asymptomatic, she refused any additional work. However, 9 months later, she came back to the same dentist complaining that she felt sensitive something on the lower right side, exactly where we have pinpointed the area on the previous exam. And subsequently, she was diagnosed with gingival inflammation, furcation, and unfortunately, extraction was performed because it was too late to save the tooth. Here's another case study where this woman has been mastectomized already. We took an image of her face, and you can see on the same side quite a large area of inflammation. We sent her to an oral surgeon, and this is a letter on this side that basically an oral surgeon wrote a letter back to us confirming all of the findings in her kind of oral stage. And unfortunately, I have to say that, of course, she's not going to get breast cancer because she doesn't have a breast anymore. But I suspect that one of the leading causes of her breast cancer, something that might have pushed her over the edge, was specifically what's going on in her mouth that was never addressed until she had thermographic imaging. Now, this case, again, we can see that there is TMJ, temporomandibular joint disorder, and possible dental involvement. Of course, if you look at the breast, you're looking at the hot spot area covered with red and white, which is very, very hot, and abnormal nipple temperature, global hypothermia of her left breast, and of course, breast cancer later was confirmed as well. And finally, I want to show you a case where thermography really played a role and kind of changed my mind because I write reports for these women. She came in for a full body report, and when I looked at her breast first, as you can see right around here, there was a hot spot, and I thought, well, maybe it's not so bad. Maybe she's kind of equivocal. Let's just maybe explore a little further. Once I realized that she has the same kind of hot spot on the right side of her face, I was certain that we definitely need to escalate. Unfortunately for this patient, she was diagnosed with late-stage breast cancer. And again, here's a letter from her pathology report concluding those findings. So, in conclusion, I want to leave you with a couple of ideas what you can do. First of all, if you want to prevent breast cancer, make sure that you get thermography, dental, as well as oral exam, and your breast thermography, because it's very, very important that we can correlate, as you have just seen in the last case. Avoid root canals, find a holistic dentist, ask them questions whether or not they do root canals, and that will give you kind of a pretty good indication of their philosophy and how they practice. And finally, pay attention to your oral health. It may be gum disease, it may be root canals, it may be something else, but make sure that your oral health is in good shape. Now, for more information on dental pathology and thermography, again, you can go to this particular URL and read more about this in detail. Finally, I want to leave everyone with an opportunity to read as much as possible about breast cancer prevention, about thermography, about different conditions that you may have, thyroid, adrenals. Please visit us at thermographyclinic.com. And until then, I bid everyone, every single one of you, good health, and goodbye for now until next time.